Hey, it's Mo Egger. If you love sports, man, this is a great time of year. You've got college football, the NFL, and of course, college basketball. And there's no place to watch all the games than Long Neck Sports Grill. 3 locations in northern Kentucky, Wilder, Hebron, and Richwood. They've got 4K TVs all over the place with the sound on for all the big games. Plus, the menu is fantastic. You've got to try the wings, and no place has a better beer selection. Long Neck Sports Grill. Stay late. Come often. On Wednesdays, we talk injuries, Bengals injuries, other NFL injuries with one of the experts from OrthoCincy's. By the way, if you are dealing with an injury, you've got to check out OrthoCincy's. You never need an appointment, and they've got Edgewood and Eastgate. Those locations have extended evening and Saturday hours for your convenience. It's going to be more convenient and less expensive than an ER visit. Go to OrthoCincy.com. That's OrthoCincy.com. Dr. Shankar Narayanan is with us. Let's talk about Hayden Hurst. Hayden Hurst is doubtful for the game on Sunday against Cleveland with a calf injury. I guess we'll learn more during the week, but where we stand right now, run me through the range of possibilities from least severe to most severe when we talk calf injuries.
Yeah, so Mo, that's a good question. I mean, a calf injury is such a vague injury. You hear a lot of people that have calf strains or and it could be anything from, a strain to something that is a little bit more concerning with your Achilles tendon, but somehow is labeled as a calf injury. So for me, when I think of a calf, I think of a strain. That would definitely be the least severe. So a strain is just stretching of the muscle fibers to an actual sprain of maybe your Achilles tendon, proximally or distally, meaning upward closer to the knee, which is proximal, or distal, which is a little closer to the foot. So that's actually where you have some micro tearing of the fibers within the tendon itself. And then you have, the full-blown Achilles rupture. And, that sometimes I feel like can start off as a little bit of a calf strain or sprain. But I think that sometimes, kind of in the case of like a guy like Kevin Durant, who had that calf strain several years ago, came back and we all saw how he ruptured his Achilles tendon. I worry that, and I don't necessarily know or think that there's a humongous correlation between the two, but there definitely is a little bit of a correlation between the two. And I wonder if that, is the word calf injury could be used to label something that could be a little bit more severe like that.
Yeah, that's my fear as well. And I'm obviously far, far less knowledgeable about such things compared to yourself. For an NFL player, for an athlete of this caliber, what sort of things cause calf injuries?
Yeah, so I think sometimes stepping the wrong way, it could be a contusion because he, I believe, had that real big hit where he was kind of flipped up into the air and came down pretty hard. I don't remember if he was actually hit in the calf or if he came down on the calf, but it could be a muscular contusion. It could have stretched out as well. So those are the kind of things that can actually cause him to have an injury like that.
Give me, for folks who might suffer a slight calf injury, what are the treatments? And then if there's maybe something on the more severe end of the scale, what are some of the treatments for somebody who's suffering one of those type of injuries?
Yeah, so depending on how severe the actual injury is, treatment's going to be your standard resting it, a lot of rest, icing, especially if you have any swelling in the area or any bruising. I always like to treat my patients with compression with an ACE wrap and maybe ice over top of the ACE wrap as well. And then elevation above the level of your heart. For all of our weekend warriors out there, it's important to do those 4 things. The next most important thing is to take a consistent anti-inflammatory medication. So taking ibuprofen sporadically will help with the pain, but taking an ibuprofen or taking Aleve twice a day or maybe one of my favorite medications, Mobic or meloxicam daily for a couple of weeks will really help, because you decrease the actual inflammation because the drug builds up into your system. Then you decrease the swelling. Decreasing the inflammation and swelling will then decrease the pain in that particular area.
Let's talk about another player. We'll stay in the AFC North. Lamar Jackson, the Baltimore Ravens quarterback, has been confirmed to have a PCL sprain in his knee. There was some speculation that he was dealing with a possible bone bruise. I want to ask about bone bruises, but let's start with the PCL sprain. What is it, and what are the treatments?
So the posterior cruciate ligament is similar to the anterior cruciate ligament. It runs in the notch of the knee, except it runs from the front of the femur to the back of the tibia, and it actually prevents the shin bone from subluxating backwards, whereas the anterior cruciate ligament prevents the shin bone or tibia from subluxating forward. So as I was watching the replay of Lamar Jackson's injury, he went down directly on to his knee, and I believe it was his left knee. He went down directly onto it. He was almost driven into the ground, and that is the perfect mechanism. I actually was watching, and I was like, oh, he probably has a PCL injury, because the shin bone was driven back once he hit the turf. So what can happen is, with a sprain, it's just a stretching or micro tearing of the fibers of the posterior cruciate ligament. And sometimes what can happen is, when the bone moves, the femur moves on the tibia, you can suffer a little bit of a bone bruise. And that's where a lot of the pain, and specifically pain with weight bearing, comes into play.
Is this something that, I mean, I don't know that this is going to go away for him. Is this something that he can play with and play with effectively, or at least with the ability to mitigate the pain?
Yeah, so I would say I think it's a little difficult to play with a PCL sprain, depending on the severity of it. I think that he'll, John Harbaugh, I think, said he'll be out this week. I would not be surprised if Lamar Jackson was out 1 to 2 weeks to let this rest. And then bone bruises, unfortunately, take quite a bit of time to heal. Non-steroidal anti-inflammatory medication can help with bone bruises, but they are very, very painful. And a lot of my patients feel that it's oftentimes challenging to bear weight. So what I would anticipate is that Lamar would probably be, or somewhat have some protected weight bearing for a week, maybe 2, just to let the bone heal itself. It's just like a soft tissue bruise. The bone can bruise as well. It gets swollen. It has edema coming into it. Once you let that calm down, he'll be back to normal. He'll probably be in one of the hinge knee braces, and that will prevent his shin bone from moving back. I would tell you that it probably will limit his mobility, but Lamar Jackson's kind of a freak athlete, and it may not limit his mobility, but for most normal people, it would significantly limit their mobility.
All right, let me ask you about another quarterback, Jimmy Garoppolo. So the news on Sunday night was broken foot, done for the season. There seems to be a little bit more optimistic viewpoint from San Francisco, because they feel like perhaps he can come back for the postseason because he has avoided a Liz Frank injury. It's still a broken foot, but it's not a Liz Frank injury. What is a Liz Frank injury, and why is that more severe than other foot injuries?
Yeah, I'm not sure exactly what Jimmy Garoppolo suffered, so I'm not going to speculate into what actually happened. But when it comes to the Liz Frank injury, the Liz Frank is a ligament that is in the midfoot between the first metatarsal and it's it's in the tarsometatarsal joint. Best way to say it, it's in the midfoot. It's kind of like keeping the midfoot together, and it's what we often refer to as the keystone of the foot. If you were to look at the midfoot and you were to actually cut it in half, it would look like an arch, and the Lisfranc ligament basically helps keep the arch in place. So if you completely tear that particular ligament, or if you have an injury where there is a fracture that causes bone to migrate and actually have almost like a dislocation of that midfoot, it's a really, really devastating injury, and it can cause people a lot of pain, a lot of swelling, and in order to remediate that, you have to fix that. Now, if it's a ligamentous Lisfranc injury, there are different surgical options that are better than previous options that could potentially get him back, or could potentially get a player back on the field quickly. But if it's a bony or osseous Lisfranc, it's a pretty bad injury, and that can sometimes necessitate a fusion of the midfoot, which could potentially cause someone to miss a long, long, long period of time. Luckily, it seems like someone like Jimmy Garoppolo did not suffer that. I don't know what he suffered, but it's nice that San Francisco is optimistic he may come back in 7 to 8 weeks.
Yeah, for his sake, I hope so. He has an extensive and, of course, now growing injury history. Dr. Shankar Narayanan, OrthoCincy's, I appreciate the time. Go to OrthoCincy's if you need them. You do not need an appointment, and they've got the Edgewood and Eastgate location. They've got extended evening and Saturday hours for your convenience. Check out OrthoCincy.com, OrthoCincy.com. Hey, if you're a college basketball fan in Northern Kentucky, the best place to watch all the games is the best place to watch football, too. Long Neck Sports Grill. 3 locations in Northern Kentucky, Wilder, Hebron, and Ridgewood. 4K TVs all over the place. And, of course, the sound's on for all the big games. And don't forget, the menu at Long Necks is extensive. I love the wings, and no place has a better beer selection. Grab your buddies, watch college hoops, watch football, have a blast. Long Neck Sports Grill. Stay late, come often.